A stroke or traumatic brain injury to one side of the brain is a life-changing event that causes the other side of the body to become super weak, completely changing the way a person scoots, stands up, and sits down. I'm Dr. Alison Wu, physical therapist and board-certified clinical specialist in neurologic physical therapy. Today, we're continuing with our last video, aimed to help you figure out how to help this patient recover that weak side as soon as possible. Once the map in our brain is damaged, the brain can't talk to half the body, which includes the face, throat, arm, trunk, and leg. All of this body training is actually to help the brain wire a new map. In a newly injured stroke patient, the body and weaker leg tends to be very noodly or flaccid. We need to build the brain map to control that weaker trunk muscles and the leg. Today, we have Alex here. He suffered a traumatic brain injury almost 9 years ago. He's been participating in therapies all these years and works super hard. Once a patient is stronger and can follow directions, scooting is a great exercise. Scooting forward, scooting back, to the left, to the right challenges the use of the weaker arm versus no arms and using the weaker leg. Most important thing about scooting is don't let them use their back against the chair to scoot their butt forward. They have to bow forward and work on scooting their bottom forward. If they build this bad habit of scooting or leaning back to push their hips forward, when they stand up, they tend to not bow forward enough and they end up falling backwards more often into their chair. You ready to show that? We're going to scoot forward into the seat and backwards and practice a few of those. Show those a couple times. So I'm going to give a downward forward pressure into the ground and forward to help him scoot. And I'll help him in his butt a little bit if need be. I'm always gripping the side of the hip, not the middle. No wedgies. Okay, and he works on bowing forward to scoot his bottom. Go ahead. Nice. Good. And try to scoot back. Good. Good. Okay, and forward. Nice. Now for scooting back, I can give his hips a little forward up pressure, and I give his knee a little bit of a back assist. Okay. Better, and that was a better lift. Okay, let's work on scooting sideways. Which side do you want to go first? Let's scoot to the right then. Okay, first thing first.
Am I right or your left?
You're right. Good question. We'll take steps first, right? So pick up your weak leg. Don't help it, cheater. Okay. Okay, left leg over here. Good. We're going to lean forward and lift. Beautiful. Okay, weak leg. Nice. And good. So this hand is giving it down and forward. My backhand is doing a little seesaw effect to help give him just a little bit of lift. I'm barely helping him. Okay? All right, we're going to go back the other way. Good. So this case, I'm going to actually help push the knee. Nope, cheating. Good. Whoop, there he goes. Good. Whoop. Okay, let's bring this leg closer. Good. Don't help. Okay. I'm going to try scooting to the right again. Let's move this leg over a little bit more. I'm going to start turning that way a little bit. Okay? Try to push off this weak leg to help, okay? Better. I have them not help the weak side with their strong side because studies show over time the strong brain completely silences the weak brain and takes over everything, which is why I'm always cueing all my stroke patients, even if the leg is dead weight, do not help with your strong side. I will help it. And you just focus on trying to talk to that weak side to move it, to regain control of that side and help the weak brain rebuild its map. In physical therapy, we measure patients' fall risk using a sit-stand test. The arms are crossed and looks at how fast someone can fight gravity, standing up and sitting down. The stronger the glutes, the better you can fight gravity, the less likely gravity will win. Okay? I personally love to start doing this with my new stroke patients in the hospital. Of course, when they're medically stable, even when their leg has zero, and I mean zero firing. First, feel the movement yourself slowly. Notice I have to bow. My center of gravity and my weight transitions forward onto my feet and up to full standing. Look how forward I have to bend in slow motion. Also sitting down, I have to fold at the hips and slowly bend forward so I don't flop backwards. Also notice if I sit too far back, then I can actually use my legs and kick against the seat to stand up using my knees and my quads, and that's not safe. If I'm sitting on a beach chair, we're flipping. And I can also do this, not bend over, and flop back down. Ideally, we want our patients to use the whole complex, glutes and the legs. So make sure they're scooted relatively more forward, feet are flat on the ground, and they can bow and stand up using their butt strategy. This is called your hip hinge, hip flexion glute strategy. The more the patient bows, the more they use their glutes naturally, the easier they stand, and the less work for the helper. If the helper is too close, when I help in front, then you see if he tries to bow forward, then I block him. Okay? So for people who need more help and you have to help from the front, I have my leg in the middle of his body. Okay? And then I'm blocking his knee in front, arms across your chest, and we'll practice helping from the front. Okay? And together. And nice, smooth up. Good. Then I bring his hips towards me, nice and tall. Good. Beautiful. Yeah. Okay. And then let's take a bow. And I take a seat with him. So the most important thing about the helper is they have to lean back and sit. For the taller people, try using a stool. Okay? Before doing that, I forgot to mention, make sure his feet are square in a good spot. His feet are too close together, too far back, too far forward. Makes the standing up really difficult because the base of his support is not in a good spot. Best wishes. You can do this. Yeah. Let me know if you tried any of these strategies and how they work for you. I'm Dr. Alison Wu. Remember, we heal smarter, not harder.